Welcome, everyone. We're going to just give people a few more minutes to join in. So we'll start in about 2 minutes. Welcome, everyone. We're going to start in about 1 minute.
Hi, everyone. Good afternoon or good morning, depending on where you are. And I want to thank you for joining us for today's briefing on the COVID-19 National Emergency Declaration, the Stafford Act, and an overview of the most recent stimulus package for states, the CARES Act. I'm Susan Frederick. I'm Senior Federal Affairs Counsel and Committee Director for the Law, Criminal Justice, and Public Safety Committee at NCSL in our Washington, D.C. office. I'm joined by my co-director, Allison Lawrence, who is Program Director of the CJ program in our Denver office, and Senior Policy Specialist, Lucia Bragg, who leads our Disasters Partnership, also in our Washington, D.C. office. Our criminal justice team is also on this call, ready to answer questions if needed. Amanda Essex, Amber Widgery, I see Sarah Brown here. So welcome, everybody, and thank you all again for joining. Most importantly, I want to just say I hope all of you and your families are healthy and safe during this pandemic and these crazy times. We are trying new technologies at NCSL in order to continue to provide effective platforms for education and information dissemination. And so we hope that this Zoom platform is workable for everybody, and please provide us with feedback, pro or con. We're learning every day as we go through this. First, I want to mention a few logistics. Allison Lawrence is managing our controls today, and everyone is currently on mute to ensure audio quality of the presenters. And as we go through the briefing today, please type your questions in the chat box. The way you find that, you can access it by clicking on the word bubble symbol in the navigation bar. This chat will be saved, so if we can't get to your question during the Q&A, we will respond after the briefing ends. Your questions can be sent to the entire group or directly to Allison through the options in the chat box. And if you are participating by phone and you have a question, please give Allison a call at 303-856-1526. Again, that's 303-856-1526. And if you are able to use the chat box, send your, or if you're not able to use the chat box, I should say, you can also email your questions to Allison Lawrence, allison.lawrence@ncsl.org, and she will type in her email address for you all to see if you're using the chat box, and if not, let us know. We anticipate that there will be quite a few questions, and we hope to hold follow-up briefings on various topics of interest related to COVID-19 issues within this committee's jurisdiction. This briefing is also being recorded and will be posted online along with presentation slides after today's call. For the access to that, please visit NCSL's COVID-19 State Resources page at ncsl.org under the Criminal Justice tab. Before we get into the Stafford Act and the disaster declaration issues, I want to at least give you a brief overview of what is contained in the most recent stimulus package, which is the CARES Act. This is the package that was signed into law last Friday. It is the third stimulus bill, and it provides $2.2 trillion in COVID-19 response funding. Some of the highlights of that package include a $150 billion coronavirus relief fund for states. From this $150 billion, $3 billion is set aside for Washington, D.C. and the U.S. territories. $8 billion is set aside for tribes. We have estimated each state's allocations, and we have posted this on our COVID-19 resources page at ncsl.org. So if you want to look to see what our estimated amount is for your particular state, please visit that link on our website. One of the things that we have been doing in recent days is talking with the Treasury Department, which will be the agency that implements and sends out this funding. We have confirmed that the money will go directly into your state's general fund around April 24th. If your state has local governments with over 500,000 people, 45% of your state's allocation will be set aside for those municipalities. Those local governments must make a request directly to the Treasury Department for those funds, and they must substantiate that request with an accounting of what that money will be used for and how it relates to COVID-19 response. If your state does not have any local governments with over 500,000 people, your state will get its entire share, and it will be at your discretion, at the state's discretion, to determine and decide how much your local governments within your state will receive from your allocation. Another thing that we've learned from the Treasury Department conversations is that this money can be used for state expenditures and costs related to coronavirus through December 30th, 2020, and cannot be used to backfill any revenue gaps or budget shortfalls that you have experienced as a result of the virus. The Treasury Department has suggested that the 6.2% increase in FMAP funds contained in the Stimulus 2 bill, the Family First bill, could be used with some flexibility to deal with revenue losses, but they're confined by statute and cannot allow that money to be used as backfill. We continue to work with the members of Congress and the Treasury Department to address this issue. We know that there will be a fourth stimulus bill forthcoming in the next several days, and it is taking shape today. So state revenue losses certainly are our number one concern and request for additional federal funds to help with that. Just to touch on a couple other areas of the CARES Act that you may find of note, there's $45 billion for the Disaster Relief Fund, which we'll discuss in greater detail momentarily. $400 million in election security grants. We are hearing that a few states are going to use this share or their share of this funding to conduct vote by mail in November. $850 million for burn JAG formula grants for law enforcement. Want to remind everybody that 60% of total burn JAG funds are allocated to the state administering agency, or SAA, who in turn passes a designated percentage through to local governments, and then through them to other organizations, including nonprofit service providers. The remaining 40% goes directly from the Department of Justice's Bureau of Justice Assistance to local criminal justice agencies, including law enforcement. Two other provisions of note: $2 million have been appropriated for justice information sharing technology, which will promote video conferencing abilities for prison healthcare and court proceedings to keep everybody safe from the virus. And the deadline for Real ID compliance has been extended by 1 year. Enforcement will now begin on October 1st, 2021. In sum, the total across the three stimulus bills that have been passed by Congress and signed into law is accounting for some 60 programs that will have now have funds available for states. So this will take some time to roll out, as you can imagine. I would like to now turn the briefing over to Lucia Bragg, who will present on the National Emergency Declaration and Stafford Act issues that impact states.
Susan, there's just one clarification. Did you say 4 to 5% or 45%?
45.
Thank you.
45.
We'll get to the other questions that are popping up after Lucia's presentation.
Hi, Lucia Bragg, Senior Policy Specialist at NCSL. I know we only have a half hour today, so I'll try to keep things as concise as possible. First, I'm going to share my screen with everyone so that you can follow along with me. Oops. Here's the beginning. So, I will note that I have this presentation going, but for folks on the phone, I will be sure to explain things in detail so that you're not missing out on anything. This PowerPoint is just a way for everyone to kind of follow along together. So first, I will review for everyone a timeline of emergency powers used by the president so far and what they mean for states broadly. Then I will cover the scope of the Stafford Act generally, and then as it relates to COVID-19. Finally, I'll mention a few additional resources in case folks have further questions that we're unable to answer as part of this presentation. So the president, first I'll go over a little timeline of key actions in the emergency kind of space with COVID-19. So, the president has employed emergency powers under 4 separate statutes for COVID-19. And these actions have varying implications, but collectively allow the federal government to deliver virus response funds and other assistance to state and local governments. So beginning January 31st, the president declared a national health emergency under the Public Service Act. This allowed the president and the HHS Secretary, Health and Human Services Secretary, Alex Azar, to establish the Coronavirus Task Force, issue multiple policy modifications, and waivers to support the response of the healthcare community. On March 13th, President Trump declared a national emergency declaration under both the Stafford Act and the National Emergencies Act. So the Stafford Act, I'll mention generally now, but we'll go into more detail. The Stafford Act generally is used for natural disasters, and folks are more familiar with that. But it can be used for pandemics, obviously, as we're seeing. So as used for COVID-19, it allows states to access FEMA public assistance grants for emergency protective measures. It also allows states to access assistance from, FEMA incident management assistance teams, tax filing and payment extensions for affected taxpayers, and many other kind of points of assistance that I'll cover in a second. The National Emergencies Act is different. It's broader, generally Section 201 and 301 of the NEA authorize the president nearly unlimited discretion to declare a national emergency. The NEA was enacted by Congress to formalize presidential and congressional powers surrounding national states of emergency, so it's pretty broad. But the law does not itself provide new emergency authorities to the president. It does allow activation of powers that already exist and are provided for in other federal statutes. In this particular scenario, the NEA allows the Secretary of HHS via the president to exercise the authority under Section 1135 of the Social Security Act to temporarily waive or modify certain requirements of the Medicare, Medicaid, and state children's health insurance programs, as well as the privacy rule under the Health Insurance Portability and Accountability Act throughout the duration of the pandemic. So these waivers, importantly, can loosen restrictions on the use and have on the use of telehealth and certain requirements for hospitals and healthcare providers to improve their response efforts. It's worth noting as well that, on March 18th, the president signed an executive order invoking the Defense Production Act. So the DPA allows the president broad authorities to compel domestic industry production for the sake of national defense, including emergency activities under the Stafford Act. It can require that health and medical resources that are both scarce and critical for national defense are efficiently produced and distributed to health workers on the front lines of the response. And so this can include ventilators or personal protective equipment, such as masks, gloves, and other medical supplies. The president did not immediately take action under the DPA on the day of the executive order to force private companies to produce medical equipment, because he was reporting that the private sector had actually been pretty willing to help voluntarily. However, last Friday, the president announced he had done so. So he had used the DPA with General Motors, so requiring them to accept, perform, and prioritize federal contracts for ventilator production, which obviously they don't otherwise produce. It's worth noting as well that this isn't an emergency power necessarily, but President Trump named FEMA the lead agency in the COVID-19 emergency response efforts, which was a distinction previously held or assigned to the Health and Human Services Agency. What this really means is that FEMA will coordinate the response effort, but HHS and CDC remain in control of the medical aspect of the response. So FEMA has the proper logistics and systems, or logistics management systems, as well as connections and relationships in place to state and local governments to execute response efforts efficiently. They're also in an important unique position for interagency coordination. So through its national response framework at FEMA, it's in a position to kind of bring other agencies into the fold and direct them in different ways, such as the Army Corps of Engineers, for example, which can help states set up emergency medical infrastructure. Another example is the Department of Transportation, which can help support supply chains. So one thing I'll note, for the group that's worth remembering is that requests for assistance will go through a certain chain of command. So they're supposed to go from the locals to the state emergency management agencies, and then FEMA regional offices after that, and then eventually to FEMA's National Response Coordination Center in Washington, D.C., if those other layers have not, been able to answer that request for assistance first. So that's important to remember. FEMA will field requests that channel resources and supplies that are for areas hardest hit by the outbreak. So that's kind of our timeline. So now, I'll go into the Stafford Act. I'll give a general overview, and then what the specific provisions and parameters are for the actual COVID-19 National Emergency Declaration. So first, emergency and major disaster declarations are typically require a governor's request based on well-documented and verified cost estimates via preliminary damage assessments. That's what they're called. But Section 501B of the Stafford Act actually allows the federal government to declare an emergency without a governor's request, when the primary responsibility for the emergency rests with the federal government. So this is not a section of Stafford that has been used, recently at all. It rarely is. So I think everyone's kind of learning on the fly a little bit with regard to that and what Stafford means for a pandemic. So it's worth noting that there are different kinds of declarations that allow for access to different types and amounts of assistance, and both of them come into play for COVID-19. So emergency declarations, which is what the president issued, he issued a national emergency declaration, are more limited in scope. So typically they only award public assistance grants, categories A and B, which are debris removal and emergency protective measures. They also could award, individuals and households program under individual assistance, but rarely do they award, other types of grants under FEMA recovery grants. Emergency declarations are also capped at $500 million per emergency, which in this case means per state. And so that's kind of like the blanket rule that was applied with the National Emergency Declaration. However, major disaster declarations are different. So they're broader. They grant possible access to any type of aid under the Stafford Act recovery programs, but exactly which programs are specified in the declaration language. So just because a major disaster declaration is, approved for a state doesn't mean that they get access to everything under the sun with regard to FEMA. So generally speaking, like I mentioned, this could include other categories under public assistance, hazard mitigation assistance, and individual assistance, which, in the current conversation could mean, individuals and households program, disaster unemployment assistance, mass care, and emergency assistance, as well as others. The list goes on and on. And importantly, with major disaster declarations, states can access more than $500 million, worth of assistance. It's worth noting, the DRF funds these grant programs, and it was funded at $42 billion at the time of the national emergency declaration, and has received an additional allocation, as Susan mentioned, of $45 billion last week. But it's hard to pinpoint how much is exactly in there because there are expenditures coming out all the time as well. So for the COVID-19 declaration in particular, what it does is it limits FEMA's recovery funding to emergency protective measures. So under public assistance grants, or Category B measures, which I mentioned before. These are measures taken to save lives and protect public health and safety. In this case, they must be taken at the direction or guidance of public health officials in response to COVID-19. They include, such activities as, the activation of the State Emergency Operations Center, the National Guard costs, and law enforcement, and other measures necessary to protect public health and safety. For specifics on what this means for COVID-19, though, I would direct folks to FEMA's fact sheet detailing the types of emergency protective measures that are eligible for reimbursement under public assistance for COVID-19. They issued this around on March 19th. So it's something that I'm happy to send around to folks, and we can be in touch after the call. So the other, a couple more notes about the National Emergency Declaration. It does not authorize funding under FEMA individual assistance or hazard mitigation grants. It provides, FEMA incident management assistance teams to state emergency operations centers to aid in COVID-19 response efforts. So, these are senior level, emergency management professionals with expertise in operations, logistics, planning and recovery. So they kind of like facilitate the kickstarting of the response in the states and help with coordination. The National Declaration also provides access to $7 billion in economic injury disaster loans. It's a program under the Small Business Administration, but is a disaster program, so it's affiliated with Stafford. And so small businesses can apply online for those, and it assists them, with various economic recovery kind of measures. It also authorizes the Treasury Department and the IRS to grant filing and payment extensions for income taxes and other taxes administered to any taxpayer determined to be effective for up to 1 year. And so we've seen those extensions already. And then in order to access any additional forms of funding, so this is the crucial part, and where I'll pivot to the next section. States must submit those major disaster declarations, so a separate major disaster declaration request for the state. So moving on to my next slide here, I'll go into a little bit about state major disaster declarations, what they mean for states now and what they might mean for states in the future as far as important funding for COVID-19 response. So far, and this is as of yesterday, and this is really changing like by the hour, FEMA has approved 29 states and territories for major disaster declarations already. I'm not going to list all of them. They're there, in the PowerPoint. If folks would like to read them, and of course, anyone can follow up with me, and I'll give you an update. But the obvious ones are California, New York, New Jersey, Washington received some right off the bat. We also have DC, Puerto Rico, many, if not most, New England states have either applied or requested or been approved. So a lot, like it's most states at this point. More have been approved than haven't. 7 states and territories have requested major disaster declarations and wait for approval. Those are listed on the screen as well. But Arkansas, Hawaii, Indiana, New Hampshire, Virginia, and West Virginia. And again, this is of yesterday, so they could have received approvals in the last 24 hours. So it's important to know, what does this mean? Like, what does the major disaster declaration mean for states? And I'll try to explain kind of what it means now and what it means in the future, what it might mean in the future. So right now, all of those states that have been approved for a major disaster declaration have only been approved for one additional form of funding beyond the public assistance we've already talked about, and that's for crisis counseling, which is under individual assistance. Obviously, there's a world of other categories that would make a big difference that states have not been approved for at this time. But, you know, and it's worth mentioning that in addition to that crisis counseling, there's a handful of states that for which the president activated the National Guard under 100% federal cost share. So that allows governors to call up the National Guard to support their disaster response efforts, 100% paid for by FEMA. So it's worth noting that, you know, FEMA is essentially trying to avoid duplication of benefits issues by only awarding that crisis counseling. So FEMA cannot provide assistance for a need that is otherwise met by a separate federal funding stream. So there's a distinct possibility that FEMA will amend and broaden the additional funding approved for major disaster declaration states following the implementation of last week's congressional action happening now. So obviously, like, it's a big question what that implementation looks for. Will it cover the needs that it meant to cover, set out to cover? That will be an important question for FEMA because you know, it might be the case that FEMA sees the need is still unmet and they open up other categories that might be able to help out as well. At this time, it's only crisis counseling, but NCSL is watching that very closely. And so please reach out anytime and we'll be providing updates if those categories get expanded. So FEMA, of course, continues to send medical supplies to high-risk states as well. So as an example, you know, medical supplies were sent to California, New York, and Washington, as folks know, directly after their major disaster declarations, which they were some of the first. And so that included, you know, respirators, surgical masks, gowns, and face shields, coveralls, gloves, any number of things. We don't have a central, they're not posting centrally those totals or where they're going at this time. So I don't have final numbers on them or like daily numbers on them, but just know that, you know, that's happening as well. And as Susan mentioned, the stimulus provided $45 billion for the DRF for FEMA, $25 billion of which is to be reserved for states with major disaster declarations. So you can only access that $25 billion, that pot, if your state has declared a major disaster. So I'll go into how can states access this assistance. So a lot of this is something that if folks know Stafford, they've already seen, but there are a couple of specific COVID you know, notes to take into consideration as well. So initially, there's like an initially, like immediately, you know, there are things states have to do in order to access assistance, and then later on, there are kind of reimbursement measures that go on. And so first I'll cover initially, governors must work with the applicable FEMA regional administrators within their FEMA region to create a FEMA state agreement. So that's a document that importantly confirms the state's commitment to pay 25% cost share. It also states understandings and conditions under which the assistance will be provided. It's kind of a roadmap. It describes the event, the incident period, which is COVID-19, obviously, and the type of assistance being used. So that FEMA state agreement is critical. And I'm pretty sure all states have that at this point. States must operate their emergency operations centers, which they have done. And then, you know, it's worth noting there is a separate process in the kind of beginning days for access to SBA's, or the Small Business Administration's, economic injury disaster loans. So briefly, first states have to submit their own economic injury disaster declaration request to SBA, and which has to be approved by SBA. So that's a separate declaration request. All states have already done that, and all states have been approved. So at this point, small businesses can apply online with SBA directly at any time. And the program allows businesses of all sizes, as well as private nonprofit organizations, to borrow up to $2 million to replace inventory or other business assets lost as a result of the outbreak. So a couple notes, the CARES Act simplifies this process even further for applicants. And SBA is still in implementation mode right now, but they've said that they will have some answers, final answers for what that looks like on Friday. As well, worth mentioning, 2 out of 3 COVID-19 bills passed by Congress so far have had additional funding for the economic injury disaster loans. So again, that title, as they continue to be expended and money continues to be appropriated, kind of fluctuates, but it's sort of started at $7 billion anyway. One thing that folks might be interested in as well, the CARES Act makes all applicants for EIDL loans eligible for automatically $10,000 in small business grants as well. So without a separate application process, you've applied for EIDL, you're automatically considered for $10,000 in grants. So without a separate application process. So that's all worth mentioning, and that kind of happens up front. So then there's other actions, important actions, especially for FEMA funding, that states need to complete later on. So first of all, states must submit for reimbursement under the public assistance category B and any other categories they qualify for via a major disaster declaration down the line if FEMA decides to open up those categories. So again, this is a reimbursement process. FEMA does, it's not like FEMA submits like a block grant or a sum of money up front that states can then expend as they see fit. States spend the money with the assurance, because of a major disaster declaration or the emergency declaration, that they will be reimbursed for those categories. So it's important, obviously, to document everything and submit for reimbursement later. So FEMA, it's important to note, for COVID-19 has created a simplified public assistance application process. So they have released details on it, which should make life easier for applicants, but it is not yet live for use. It should be in the coming days. Again, as a reminder, FEMA will only reimburse 75% of eligible costs, by and large. States must cover the other 25% at this time. And it's worth kind of mentioning again that FEMA assistance will not duplicate other assistance that's provided or available under the authority of other federal agencies. So this includes HHS, right, which is like currently, providing a lot of funding to states. So this may affect eligibility, states' eligibility for, or individuals' eligibility for reimbursement down the line, if that benefit is considered duplicated. So one last thing I'll just note is that, we've really talked about the emergencies aspect of COVID-19 and what that means for states and around FEMA and the Stafford Act. But of course, there's a world of questions out there that have to do with that broader picture. So it's worth mentioning that NCSL has a COVID-19 webpage that is, a central spot for all of NCSL's resources on the COVID-19 response. So health, labor, education, et cetera. NCSL also has a summary of the CARES Act and the stimulus package available on our online as well. NCSL has a brief on the COVID-19 emergency powers, which goes into detail about what I've talked about today as a reference. And we also have a federal announcements page, which is kind of a central spot where folks can refer to get the latest from a host of agencies that are releasing updates about this all the time. So again, my name is Lucia Bragg, Senior Policy Specialist at NCSL. There's my email if, for folks that are tuned in on their laptops and can see, it's lucia.bragg@NCSL. And then my number's listed there too, 202-568-4883. But of course, please contact Allison with any questions, and we will be sure to answer them as soon as we can, or bring in the right staff at NCSL to help out. And that's it.
Thank you, Lucia. Out of respect for everyone's time, since we're 4 minutes over, I think Susan's going to make a few concluding comments. I just want to remind everybody that you can access the NCSL webpage. In the chat box, I have put my contact information for all of you. For folks at home, it is Allison with 1L .Lawrence@ncsl.org and 303-856-1526. Continue asking your questions. We'll save the chat box so you can see those. Susan, would you like to wrap us up?
Sure. So our time is up for today. Thank you, everybody, for tuning in. Just want to reiterate one point because it came up in the questions in the chat box. and that is where does the CARES money go when your state receives it, and how is it to be used? For those of you who might have come on a few minutes late, your state share of the $150 billion will go directly into the state's general fund. And you can check on our website. We have estimated allocations for every state and the territories. So ncsl.org, state resources for states. There is a box there on the stimulus, and you can click on that and see what's been estimated for your state. What you can use it for, it's a forward-looking allocation, so you cannot use it to backfill budget shortfalls, but you can use it for expenditures related to COVID-19. We are awaiting official guidance from the Treasury Department on any more specific language and guidance than what I've just told you. We've had 2 preliminary conversations with Treasury. That's pretty much how they laid it out for us. And just one more contextual piece here is that we are thinking there will be a 4th stimulus package that will address some of these remaining issues with respect to state budgets and local budgets as well. And as soon as we get some information on that, we will be working to make sure that state interests are protected in whatever comes forward as a 4th stimulus package. Please send all of your questions to us. We want to help and be as informative as we can, given the changing nature of events on pretty much an hourly basis. So again, no question too stupid, no question too vague. We'll do our best to get back to you. So with that, I'll conclude. Have a great rest of your day, everyone, and we hope everyone continues to remain healthy and safe. Thank you so much. Have a good one. Bye.